So what clinical challenge does this session sort of help to solve? We've already covered it a little bit, but
Yeah, so again, I see the most value in this in FP1 restorations. And, just to give a big picture, the FP1 is, I think, the most technically demanding guided surgery, or I should say just full arch approach in implant dentistry, because, again, the positioning has to be so precise, the management of, individual bone levels, with an FP3, we can just do a big flat plane of reduction, which is really forgiving because you're going to build all the gingiva into the restoration. But once we're at FP1, we've got to actually build in the gingival scalloping and architecture as well as the bone architecture. And it's just simply difficult to execute on, which is why many people don't do it. But that, I think, is a disservice to our patients, because to not do that means we're going to have to remove excessive bone. And so this is going to address the difficulty aspect of that. We just found this. Developed this primarily in conjunction with Danny Doming, who's a big name in the AAID and does a load of full arch cases. But you know, Danny's used every kind of guide under the sun, does most of his stuff guided for full arch, and tries to do FP1 every time that it's an option to do it. And this has been a complete game changer in his practice, to the point where now it's pretty much all he does and doesn't want to do any of the other type stuff, because it has been so helpful. It's so much easier to use in a clinical setting. And so that's kind of the issue is it's addressing, is allowing you to get that accuracy to execute those really difficult FP1 cases, but without spending thousands on these complex guides and things. This is a simple, straightforward solution that allows you to do all that.